Thank you for staying with Sharaad and I on Consider This. We're speaking tonight to Dr. Amar Singh, a senior consultant pediatrician retired from the Ministry of Health, and he has just recently written an opinion piece arguing that Malaysia is not yet ready to lift the MCO. Amar, just before the break, you talked a little bit about how the MCO has been effective, but it's not sustainable in the long run, right? Talk to us about what we need to consider as and when we're thinking about transitioning out of an MCO. What are the things we need to sort out, so to speak, before we can lift the MCO?
I think let me frame that in a broader context. If you look at slide number 9, I think we need for every individual, as they come out of the MCO, to behave in 3 ways. The first way they behave, on the slide I only put 2 of these ways. First way they should behave is that they should treat everybody they meet as possibly COVID-19 positive. And so they got to distance themselves. Secondly, they should behave as though they themselves are COVID-19 infected but asymptomatic and they might give it to someone else. So they should be careful how they interact with other people. And thirdly, what I didn't put in the slide was that they should, whenever they see someone who's older, they should think that their father or mother, they see someone who's fragile with hypertension and diabetes, it's my brother or sister, and think that we don't want to lose these people, they want to protect them. I think we have this kind of frame in mind, and we can then move forward. If you look at the next slide, 10, I suggested that the MCO can only be lifted when the majority of the Malaysian public change their behavior, become responsible, and cooperate. We won't have the ability to overcome this if only 50% of people change. If 70% of people change not enough, even 90% perhaps is not enough. We need the vast majority of Malaysians to come on board. And as I said earlier, I'm not sure this is true for everybody. You know, the fact that the police can still arrest people right now during the MCO means that after the MCO is over and the police have less powers to arrest people for this sort of thing, we may not find the same cooperation and responsibility taken.
Well, this is very interesting because, the defense that Sweden, and I refer here to the Deputy Prime Minister, has made in terms of the Swedish model is precisely this, the idea that they were going to have a milder lockdown because it was a marathon, not a sprint, and also that a milder lockdown, invoked a cooperative spirit rather than a dependence on punitive measures. Malaysia has set up prisons, all kinds of interesting authoritarian responses that we've had, which don't require a positive buy-in. And now we're saying, lift the MCO, and now we want to encourage a positive buy-in. Are we kind of shooting ourselves in the foot?
Well, I think that, most countries in the world have gone for a hard lockdown. I think the minority like Sweden have gone for a limited lockdown. But even though we say limited lockdown, if you read the people who talk about Sweden, their population is extremely disciplined, very responsible, and their lockdown is not as mild as we see it from here, that we see exactly what they're doing. They've actually tried to shield all the older people. You can't even stand up. If you go out to eat, you can't stand up. You have to sit down at your table and food comes to you. People are socially distancing significantly. So I think their lockdown is not as mild as we think, and we have got a very cooperative population. Government trusts immensely, and a very transparent data sharing mechanism in the country. So we've got some things going for them that perhaps we're not as up to the same mark. So I think we have different populations and different strategies required. I do believe we need to relax our MCO, but I think if you want to relax our MCO, it's got to be in stages. It can't be sudden. Maybe we can adopt what UK is trying to do, that they might allow people to visit their family only first. And then the next stage is allow businesses to get back. And as we have done, we've tried to let some businesses get back. I think what many countries have held back is on schools, because they know children, although they may not get severely ill, are vehicles to spread to their family. What many countries are very slow at adopting is religious bodies, letting them get back. I think even Italy is not letting the church come back too soon. They want to hold that back to later. So I think that what we need in our MCO strategy relaxation is a stage-based relaxation to wean the public back into it. But the public need to recognize that we are not coming back to the societal and communal level that we were before. You can't sit down and just casually eat with someone. So I asked this question, are our supermarkets ready? I think they're not too bad. I wrote an SOP and I think they're pretty up to the mark, some of them. But are our makan place ready? Is the average corner coffee shop? Is an aircon place to eat a safe place to go to? Can children of 40 children in one classroom be a safe classroom to go to? Or will it cause spread? So I think we've not answered many of those questions.
Dr. Amar, can you talk us through what we need to think about when we want to lift the MCO in stages? And when we're thinking about that approach, what kind of timeline should we be considering? Should we be waiting for cases to be zero? Because right now it's double-digit cases at the moment. So what's the benchmark that we should be using in terms of thinking about lifting the MCO? I'm looking at Hokkaido. Experts are saying Hokkaido lifted their lockdown a bit too early, and now they're seeing another wave. What are your thoughts?
I think Hokkaido is a good example. I think they did a very good job, and then they had a slip there. Now they are back to lockdown. I think they've been uncharted territory in answering this question. I think no one's really able to answer your question. I think we could look at all the countries around us that are trying. Look at Sweden, which is different. Way they're doing it. We look at China, look at Italy, look at South Korea especially, look at Taiwan. I think, and also the UK. I think these countries will give us an idea which way we can go. Of course, one very important thing is we shouldn't have community spread continuing, and that requires a lot of monitoring that we need to do. But remember that whatever we do today, the impact is going to be seen in 4 to 6 weeks, and that's part of the problem. This lag time, it's going to create a bit of a problem, whichever measure we take. But as we know, we need to stagger this. We need to do it slowly. In UK, what they've done now, they've suggested that people, maybe they can meet families. In Italy, they're saying you can go back to some businesses, and they can go out into the park. And I think Malaysians would appreciate very much being able to walk around a little bit and do a bit of exercise. I think that, so we can open industries as we are doing partly, and then maybe offices after that. What people have been very slow at deciding is about school, because we know children can spread the virus. And people have, of course, been very, very slow at religious organizations. And in Italy, they're very slow at opening the church because they worry about the spread there. But I think if you think through the whole issue, let's take an office, for example. Let's say we want to go back to an office. Can an open office work? An open office is very dangerous. We see data from South Korea, from a call center, which is an open office environment, showing how many people got infected from one person, mainly because of the air conditioning. I think air conditioning is an issue in all offices. Secondly, toilets are common user items. How are we going to handle a toilet which is a lot of spread happening? What about lifts? So many of our offices in KL, in Ipoh and Penang and so on are office tower blocks. How are we going to put people into a lift and spread the virus? How long are you going to wear a mask? Maybe what we can do is perhaps stagger our office hours. Some people would come in from 8 to 12, and then a second group would come in from 1 to 5. There are many, many issues. In particular, I'm worried about the toilet, the aircon, the lift. I think that's important. Of course, staff meetings are a crisis. So anyone who can work from home. Any meeting would have virtually. So I think we need to think through all these issues, have a checklist, have a standard operating policy. Everyone gets trained in it, and we follow this as our new norm. And that's a way to reduce the virus spread. It's not going to go away, but at least we can keep it. I want the curve to be flat so that we can cope with it. I think that one of the things that we are not recognizing right now is our healthcare personnel are exhausted. They've been going on for 2 months to 3 months, just maintaining this vigilance, wearing their PPE and stuff. Some of them haven't even gone home to see their children. They put their children with their grandparents or somewhere else. How long are they going to maintain this? And so I think as a public, we need to have responsibility to really keep the virus at the lowest place possible so that healthcare professionals also can get back. I think we need to rotate our health staff as well so they get some break as well. And I think we really must ramp up our health services. We must have an access right now. We need a lot more hospital beds, a lot more ICUs, even though we don't need them right now. We must come to the place where we have one day we laugh about this and say, oh, we don't need all this stuff because we just might need it. And if we don't use this time wisely, then we will fail later.
Amar, thank you. Thank you so much for your time. Appreciate your time. That's all the time we have on the show tonight. I will be back same time with you tomorrow night with Sharaad Kuttan. We're signing off for this evening. Thank you so much for watching and good night.
Good night.